What's one thing you wish every MLA and every British Columbian understood about long COVID, myalgic encephalomyelitis, or chronic fatigue syndrome and fibromyalgia patients?
I'm going to go first, Jane, because I've got mine on the tip of my tongue.
Yeah.
The first thing for me is to realize, like just recently, I had a patient denied disability because they did not meet criteria for long COVID. Well, first of all, there are no criteria because not only are there no criteria, there's no agreed upon definition. And there's a difference between post-COVID. So post-COVID clinic is not the same as a long COVID clinic. So post-COVID, what can happen after COVID? Most of the argument right now is around how long you have to have symptoms before we call it post-COVID or long COVID. That's a mistake. It should be based on what did the virus do to you? And to me, there are 5 categories. First category are people who get tissue damage, like lung scarring, blood clots, inflammation. Second category are people who have triggering of autoimmune diseases, like rheumatoid arthritis, SLE, Sjogren's, Guillain-Barré. Next are people who have the triggering or acceleration of diabetes, hypertension, and high cholesterol. And when I say new, some people can get it for the first time, but other people can actually already have it, and it accelerates the speed to get to strokes and heart attacks. And then we get the people who have triggering psychological conditions like depression, anxiety, and PTSD. And then finally, we have the post-viral syndromes. And that's what the Mayo Clinic calls long COVID, and that's what we call long COVID. I'm not an expert in all of this. And that's why patients will come to me and they'll say, I just read a paper that I have microclots in my brain. And then you read the paper and the first thing it says is post-COVID / long COVID. So it's probably the people with the clots and the tissue damage, probably not these guys. But that's why until that gets sorted out, the doctors have a place where they can go and do searches about research papers. And there's something called a MeSH subheading. And what that means is that if you call it heart disease or coronary artery disease or atherosclerotic heart disease or angina, that you still get all the right papers. And that's called mapping. And so when you go and you type in long COVID in the database for doctors, it maps to post-COVID, which means that currently the medical research does not make a distinction between post-COVID and long COVID. And I think that we're going to continue to see lots of negative results of trials because of mixing these patients' populations up. And we're going to see lots of confusion of interpretation until there's an agreed upon definition that's based on subcategories of outcome. And so Dr. McKay is a post-COVID expert. I'm a long COVID expert. And so I know about the post-viral syndromes. Dr. McKay is expert in all of these areas. It's a big thing that I want people to know. But the bottom line is no agreed upon definition, and there are subcategories, and the post-viral is just one. But if you also think about it, blood clots, lung scarring, doctors know how to deal with that. Rheumatoid arthritis, lupus, doctors know how to deal with that. Diabetes, hypertension, high cholesterol, doctors know how to deal with that. Depression, anxiety, doctors know how to deal with that. Post-viral syndromes. And in fact, I won't say which university, but in the US, I was invited to do presentations at a university because their post-COVID clinic had never heard of post-viral syndromes. And so they were taking care of the first 4, but they didn't even entertain the idea. They would do tests and say, nope, you don't have anything. You don't have long COVID because your test came back normal. Coming back to the idea of syndrome-based. Long COVID, not the same as post-COVID.
Jane.
Valid illness is the first thing, life-changing, and needs equity. I think, from my perspective, recognition and validation from their elected representative that is elected for this moment, and also advocacy on their end.